Welcome to the topic of desensitization and post-traumatic stress disorder, otherwise known as PTSD for short. Within this presentation, we will be discussing a brief overview of PTSD, what exactly desensitization therapy is, and the methods used to treat the psychological disorder. As you may already know, PTSD is characterized as a serious mental condition that emerges when an individual experiences or witnesses an extremely traumatic event. It first came into public fruition by war veterans, but it can result from any number of traumatic incidents. These include traumas such as serious accidents, natural disasters, violent attacks such as rape, mugging, kidnapping, and even torture. The traumatic event itself can either be something that threatened the life of the individual, or they may have even witnessed it happen to someone else. Symptoms might include intrusive thoughts, flashbacks, avoidant behavior, and negative alterations in mood or cognition. Desensitization is defined as a diminishing emotional response to a negative, aversive, or positive stimulus after repeated exposure to it. It is a type of behavioral therapy that follows the principles of classical conditioning. It was developed by psychologist Mary Cover Jones after she became interested in John B. Watson's Little Albert experiment. In this experiment, an infant was classically conditioned to have a fearful response whenever a white rat was presented to him by pairing the rat with loud noises. After several pairings, Albert was presented with only the rat, yet he still demonstrated distress as he would cry and showed fear by crawling away. Even without the presence of noise, the infant had associated the rat with loud noises. Mary Cover Jones wondered if it was possible to use the techniques presented by Watson to condition the removal of a fearful response. With that in mind, she conducted her own experiment dubbed the Little Peter experiment. Within this experiment, Peter, a child with an irrational fear of rabbits, was presented with a rabbit first at 12 feet away. The rabbit was slowly brought closer to Peter with the presence of candy each time, until finally the rabbit was nibbling on his fingers, thus curing his phobia. Whereas Mary Cover Jones used desensitization to assist patients to unlearn phobias and anxieties through conditioning, Joseph Wolpe created a hierarchical list method which intensified anxiety-provoking stimuli in a series of steps in the 1950s. The list was created by both patient and therapist together and ranked from the least to most disturbing. Once the list is developed, the client is taught deep relaxation techniques to inhibit the feeling of anxiety when it arises. Systematic desensitization is then possible by slowly increasing the anxiety-provoking stimulus while staying in a relaxed state. This desensitization method is best utilized when clients are directly exposed to the stimulus that invokes the fearful or anxiety response so that they can be paired with inhibitory responses. For example, if you had a fear of spiders, systematic desensitization could begin with you actively looking at a picture of a spider. This isn't so scary, but as time goes on, the presence of the spider will progressively increase in your proximity until you are finally able to hold it in your hand, thus curing your phobia. In the case of PTSD, there are two primary treatment methods: psychotherapy and medication. Most who experience PTSD undergo some form of psychotherapy, the most common being cognitive behavior therapy or group psychotherapy with a combination of antidepressants like Prozac and Zoloft. However, there is no definitive cure for PTSD. The absence of a cure has inspired legions of researchers to develop several experimental treatments. A popular form of psychotherapy that is building traction and has proven to work is called eye movement desensitization and reprocessing, EMDR for short. This treatment method pairs a patient's recounting of traumatic memory with steady eye movements guided by the therapist. While it is not clear why this type of treatment works, the process can often cause traumatic events to become neutral. It is believed that variations of cognitive processing therapy targets neutral circuits and reworks the brain's fear network by enabling the ability to distinguish between aversive memories and associations between neutral experiences and traumatic relocation. When it comes to soldiers, the University of Southern California Institute for Creative Technologies has developed a way for users to experience potentially traumatic events. The experiment is based on conventional exposure therapy, whereby a patient is guided by a therapist to confront their trauma through a retelling of the experience. Now, instead of relying exclusively on imagining a scenario, a patient can experience it again in virtual reality under controlled conditions. This form of therapy is actually very attractive to many soldiers, as the majority of military personnel grew up playing video games in their youth. The current concept is specifically designed to represent Afghan and Iraqi cities, as well as the desert road environments. The hope is to expand the scenarios to help as many soldiers as possible who suffer from PTSD and eventually adopt it for civilian use.